I now call to order the Tuesday, October 14th, 2025, 3 p.m. School Board Workshop. Please stand for a moment of silence, followed by the Pledge of Allegiance and the National Anthem. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please be seated. Okay, we will start with roll call.
Ramirez, present.
Janie, Ruddy, present. Christy, Chong.
Furry, present.
LaShakia Moore.
And just for a reminder to the benefit of the public that Mr. Bars has officially resigned and has been confirmed in his appointment in Washington, D.C., so we'll be moving forward with a four-member board today and until there potentially is a governor's appointment for that seat. So let's move on to our agenda for today. Are there any changes or additions to the agenda? Superintendent Moore.
Yes, I request that we move item 10.02 after public comment, followed by item 12.01, and then that we finish the rest of the agenda as printed.
Okay. Okay, so we will then move on. Well, before we do that, I'd like to have a motion to adopt the agenda as modified.
Move approval.
Motion by Ms. Chong,
Second.
second by Ms. Ramirez.
I actually would like to just add, if this is appropriate, I would like to take maybe 3 to 5 minutes for us to just reestablish some meeting norms for information workshops.
Well, that wouldn't be for today's business meeting. That would be something that we would do for our board policy manual procedures. So we'd have to put that on for discussion.
I think it's more of a reminder as opposed to establishing new policies.
Okay. We have an agenda to work through today.
Okay.
So we're going to work through what we have. So I have a.
Fair enough, I'll add
Okay.
it to the request.
Okay, that's a great place to add that. So, all in favor of adopting today's agenda as amended?
Aye.
Aye. Opposed? Hearing none, we will move on with today's agenda. And that now leads us to public comment. Do we have anybody signed up for public comment?
During the public comment.
Okay. So we will close public comment, and we'll move on with our first agenda item, 10.02, Florida Educators Health Trust. And that's Mr. Robert Olet. And
the
yes,
team has
and their
come.
team.
Yes.
Thank you.
Good afternoon, Superintendent Moore, Chairman Furry, school board members. This afternoon, we are coming before you today. I have some friends from the Florida Educators Health Trust here before you to give you an update regarding fleet. I'll let them kind of go forward, introduce themselves, and kind of tell you guys a little bit about what fleet is. For those of you who may not remember, earlier in the spring, there was a gentleman who came before us and gave you guys kind of a brief overview on fleet. Since then, there have been numerous adjustments and updates. So we just want to bring this information for you for your review, questions, and discussion. So we'll kind of go forward with introductions.
I'm Jim Powell with Alliant. We're a fleet's insurance broker.
I'm Joe Albritton. I'm the CEO of Avail Analytics, with a program manager for Fleet.
I'm Kramer Royal. I'm Chief of Staff for Avail Analytics.
Ted Roush, he couldn't be here today, so he asked me to try to fill in for him. He's the Executive Director of Fleet. I'll do my best.
All right, so if we just want to start from the top, you guys can kind of just lead us through.
Yeah, so some of this information we touched on last time I was here. The background of how Fleet came to be, its predecessor being FSHIP, those types of things. That's what this first slide is about. We can skip to the second one. So a key factor to remember when thinking about Fleet is that it's a nonprofit health trust established by the Superintendent's Association. It's run, the trustees that run Fleet are member district superintendents. It is not owned, run, operated in any way by anybody that's a for-profit entity. It's a nonprofit that operates in that capacity. Fleet contract, that board chooses to contract with program manager, that's what our role, and the broker, Alliant. But we serve at the pleasure of the trustees. Next slide, please. So since we talked last, we've grown quite a bit. We now have 12 or 13 active and engaged members. Hendry, Hardy, DeSoto, Polk, Brevard, Okeechobee are all full members. Charlotte is coming November the 1st. They've all signed participation agreements. Madison, Dixie, Nassau, Baker, and Highlands have also signed participation agreements, and they're going through the process of transitioning in. Some of them are currently fully insured. You have to be self-insured to be a member of Fleet. So we are walking them through the process of transitioning from being fully insured into self-insured to become a member. There are 2 other school districts that have on their agenda right now to sign participation agreements to come into Fleet. That would bring the total to 14 active and engaged members. Next slide, please. The exciting part to me, other than we're really rapidly growing, there are 25 other school districts, and you guys are counted in that list of 25, that we are currently walking through the educational process with them, helping them understand what Fleet is, how they could benefit, what the purpose is, and those types of things. So we've got a tremendous amount of engagement, literally from Escambia to Key West. We've met with almost everybody at this point. So it's exciting times. Things are really, really growing for us. Next slide, please. So what is Fleet? Why is Fleet? Why was it established? Pretty common issue, complaint is, what are we going to do about our health insurance? We identified 2 different criteria of what was driving some of the problems in health insurance. The first issue, if you think of it as your base cost, we have found with our member districts, and we can touch on that a little bit if you'd like us to during question and answer time. There's just a lot of redundancy and waste in the way the programs are structured. So that was one of the big first steps, was how do we drive parity, meaning to get a group into a situation where the cost of their insurance is, what they're spending is covering their expenses. That would be parity. The second issue is how do we flatten out the annual, the annual increases. The targets that we use to do that were, we drive transparency, control, accountability, meaning every contract that's engaged with fleet is fully transparent. There's no hidden commissions. Everything is known right up front. All of your data is also fully transparent, and it's housed in the fleet owned and operated data warehouse with an independent actuary and independent analyst bolted onto it. As members, more districts join fleet, you gain an economy of scale buying power on commodities. Inside your health plan, you're buying amoxicillin. The cost of amoxicillin is the cost of amoxicillin. So you get into this dynamic of, well, how do we get amoxicillin cheaper? Well, if you think about the example of what you're going to pay if you buy 4 tires versus 4,000 tires, you're going to pay a lot less with buying the 4,000. So on a district your size, when you go into a PBM and you buy pharmaceuticals or bin admin system or whatever the commodity is, you're buying it at the power of your district size, which you're 1,300 on the plan, something like that. So fleet is already at 25,000 members. So just by joining fleet, you automatically gain that buying power. And that's one of the examples of that is how your PBM was repriced, and it was built on the back of the buying power of fleet. And you'll see a little bit of an example in a few slides how that works. The financial stability that comes from the year-to-year volatility, if you just think of it in terms of basic statistics, which everybody, you love or hate statistics, and I understand that. I'm one of those people that love it. I can't help it. But if you're a small data set, the opportunity for volatility is much greater. So it's just like in anything else. The central limit theorem, would say the more you add, more people you add, the lower the volatility, the more predictable you become. That's another advantage of strength that comes from being a member of fleet, is everything can be modeled at a marginal claims level. It can be modeled on the program of 25,000 lives, not 1,200. So when you reduce that volatility, the natural outcome of that is you can better manage your stop loss, because your stop loss is the gap catch for the volatility when you have high cost claims. So if you can better manage the volatility, you can also get a big reduction in costs for your stop loss. There's rehabilitation programs. When school districts come in that are struggling, we help shepherd them through that and build out with recommended fundings, bringing levels of confidence intervals that help them get back on track. The other things we do, 112.08 filings, we do that on your behalf. Your actuary is currently doing it. We provide that, fleet provides that service. A lot of best practices we bring in. We also facilitate procurements for districts that want us to do that. We have the capacity to do that under statute 112. So that is another way to save. I know everybody in your district just loves running a procurement. So we're able to save money and time assisting in the procurements, also related to healthcare. Next slide, please. If you want me to stop anywhere in here, just stop me. Every school district qualifies to be a participant in fleet. That's the reason we moved it to the Superintendent Association, because all 67 superintendents are members, versus under what was FISBIT, only 13 districts were members of FISBIT, so we corrected that. I'll jump to the next slide, please. How does someone engage going into Fleet? You're already self-insured, so you can check that box. The next step would be for the board to adopt, approve, and sign a participation agreement with Fleet. The Fleet board would then review the participation agreement. Think of it like an application or a letter of intent to come in. And then the trustees of the Fleet board would review it and approve it, sign it. That would start the process. Then what happens is the Fleet team would come sit with you and your staff, your administrative staff, and we would build out a process map to get from A to B. How do you get from A to B? We have some districts that wanted to transition fully into Fleet really, really quickly. The fastest one, there were 2 of them. They voted on the 28th of July, and they were full active members August 1st. Really fast. There are others that want to take a more deliberate, staged approach that are looking at 1/1 of 27 to come in. Makes no difference to us. Whatever you're comfortable with, we would build that map out to get you there. And then once you formally enter Fleet, meaning the transition is complete, the superintendent would become a trustee or could designate someone to be the trustee on the trustee board. That's how you engage and participate in Fleet. Next slide, please. Successes we've had. We've got real life actual success case studies that are behind these numbers that you see here. If for a district that is fully insured, moving to self-insured, you guys have already enjoyed this, making this decision. You're going to eliminate carrier profits and taxes. That's going to, right out of the gate, drop the fully insured rate to the self-funded rate on the same risk profile, 7 to 12%. You guys are already living in self-insured world. So the next bullet up here is a savings of 7 to 13%. We are seeing that in real terms from a self-insured district, independently self-insured district, to a Fleet self-insured district, utilizing the buying power and the economy of scale and the volatility management. We're seeing that the cost of the Fleet self-insured program is 7 to 13% lower than the independent self-insured program. Those numbers have bared out to be absolutely true. The way we set up our data analysis and actuarial services, currently your data is residing in a carrier or PBM or somewhere. What we do is we build the pathway from that carrier and that PBM in your clinic or whatever the case may be into the data warehouse. And then you own and control that data. You have an independent actuary and an independent analyst telling you what it is, what the outcome of your program is, versus somebody who's trying to convince you about the worth that they are providing you. You see the actual outcome of the program. We provide performance audits on your vendors. And if there are any performance guarantees, we will support you in driving those performance guarantees to result in repayments. We've had a lot of success with that. We do that a lot every year, as a matter of fact. Last year, Hendry Schools, we ran a performance audit on their contract effectuator, found where they were lacking in the performance guarantee categories, and we got a $51,000 check written back to Hendry Schools on the performance guarantees. We conduct those on an ongoing basis. Next slide, please. Okay, this is where the broker is going to give you an example of the power of economy scale purchasing.
Thanks, Joe. I'm Jim Powell with Alliant out of Tampa. We're as I said, Fleet's broker for all the insurances. We negotiate the medical ASO agreement, the self-funded agreement. the stop loss, and the pharmacy. So we actually took, Robert shared some of your data with us, and we actually ran it through our modeling where we were able to reprice your pharmacy claims internally through CVS, that's who you're with now, and compare that with market vendors that are available in the marketplace. So what that does is that gives you a little window into what Joe was talking about, the buying power of fleet, but also there are models out there with CVS, your current vendor, that are a group purchasing organization where many employers like you have come together and they've cut a deal with CVS. You could attach onto that and that would generate savings. There's another one like that that's even bigger with United Healthcare's pharmacy company, Optum. And that one is currently spending a little in excess of $5 billion a year in pharmacy. It's the biggest GPO, group purchasing organization in existence. And they negotiate every year with pharmacy companies. It's pretty exciting. So we're agnostic. We don't care about the vendor. We just want the right vendor for you and for our clients. So we did what we call a market check and ran that through. And what we found is that those two vendors would provide pretty significant savings. Your spend right now is 2.6 to 3 million, somewhere in that range on an annual basis, so you have a point of comparison. The highest savings would be achieved by moving to the Optum RX model through that group purchasing organization. And that's conservatively estimated by our team. We're always conservative on these things. We don't want to overpromise and underdeliver. At 10% savings, which is about $277,000 just for next year alone. Those contracts are usually 3-year contracts. It has an annual market check provision in it, so you're not locked in if we negotiate something better for the following year. But when you make this decision with pharmacy, you're usually thinking about a 3-year decision. So you could reasonably expect your savings would be at that same number the following 2 years, each year. So about almost $1 million in savings just by changing vendors. Now, the benefits for the employees would be the same, so we don't want to create any disruption here. Every pharmacy company has their own formulary, their preferred drugs, and so we would give you, before you made that decision, a list of possible members that might have to make a change in their scripts, but it's usually maybe 1% of your membership population. We've got a pretty broad network.
I have a couple questions there.
Sure.
So Optum RX is this recurring pay, like you get 90-day supplies, right? So are these savings primarily for those medications that are really just everyday medications people are taking? Or are you saying across the board we can see those savings?
Yeah, it's everything. Optum RX is just like CVS in terms of their provider network at retail and
Okay.
the mail order that you're talking about. So you could have both opportunities, but you'll see savings all the way through, and we'll look at the actual dollars, and you can kind of see where that's coming from.
Okay. My next question is, you say that this is because of economies of scale, right? But what if these companies essentially go, you know what? We took a dip in Florida. Let's just raise those rates across the board, right? Because unless we're negotiating, hey, if we buy 50,000 of medication A, we're gonna, at that point, we get that discount. I'm not understanding how we're solidifying these pharmacy discounts without maybe those kind of contracts on those quantities. But it sounds like since we all can be on our own individual pharmacy program, that's not really happening. So you're just saying, hey, by pulling people together, we should be able to see those lower costs from quantity purchases. But if we're all using our own, how does that happen?
Yeah, it's interesting. This group model is unique in the industry. So right now, you're on your own with CVS. You know, they've given you pricing for your employee population. What we're talking about is group purchasing organizations. Think of fleet only times 10. There's 300 employers that are in this Optum Health Trust program spending in excess of $5 billion a year. That is bid out every year.
Okay, so
to the
you
market.
are
So
reducing,
that's-
even though you say we have
that's-
open choice, we're reducing it to a certain number that you know these other counties are also aggregating towards.
Oh, yeah, the pool is growing. So it's
Okay.
interesting, the pool enjoys more buying power every year. So not only are we projecting next year's savings, but we are predicting that same pool 12 months from now will have even better savings. And that's
Okay.
what we've seen through this market check. The market check is everything. You know, not every pharmacy contract comes with it. A lot of them just lock you in for 3 years and
Right.
you're pretty well stuck. So
And-
this
and-
gives you a lot of freedom if in 12 months, we as the broker look at it and go, you know what, we're not loving this pricing, there's a better opportunity, we'll present it to you.
Okay. And these are not, we're not swapping out medications. For example, we're not trying to go with compound pharmacies or compound medications. They're either the FDA name brand or the FDA generic, not the alternative compound pharmacies because I believe sometimes
You can't really
there's,
do
you
that
can't
anymore.
avoid
There
it,
are only
right?
certain
Lawsuits out
medications
there.
Yeah,
would be
it's
a compound
a mess.
medication.
Right.
that compound
Yeah,
pharmacy.
it's drug to drug. It's
Yeah.
about the only place we're seeing that are some of the really high-cost drugs now having biosimilars available, and all the vendors are looking at transitioning
So how is a
people to
biosimilar different from a compound drug?
So well, it's a biosimilar construction of the drug. So compounding is mixing several drugs together. This is actually a genetically equivalent drug.
So, take an example like Ozempic and Wegovy, which are expensive medications. So how does this help, like, as a real-world example?
Well, it depends how your plan covers the GLP-1s, so we would basically mirror that over. We'll typically see higher rebates specifically on those things by participating in the pool than being on your own.
You mentioned OptumRx, so OptumRx, they also have an OptumRx specialty pharmacy. So if we have faculty that has to take a specialty medication, so that, you know, life-threatening or what, but it has to be from that specialty pharmacy, are you looking into those? Is that incorporated, or would they be on their own? Because I just, you know.
No, that's part of your, if it's in your data now, it's included here, so it's.
Okay,
yeah.
so OptumRx, just as an example, we should use that because that's a well-known. So OptumRx pharmacy, CVS pharmacy, but OptumRx specialty pharmacy, that would be something that would be included.
That comes along with it,
With the
yes.
OptumRx, okay.
Yes. Yeah, we're gonna try to make this as easy on everyone as possible. We don't want a lot of disruption, and you won't see that.
Is this only pharmaceuticals?
That's the only example.
This
we're
piece,
giving you.
yeah, we'll talk about stop loss as well.
If we went through every single lever that Fleet can pull, we'd be here for hours.
I guess I'm
and
just trying to
hours.
understand, like, what
Mhm.
category this fits in. Is it like a health cost sharing? Or just that because we're pulling other counties, that's how we can bring down the costs?
Yeah, this is pharmacy only out of your medical plan, so.
Right, but
It's
you're
just-
you're saying
Talking
it's
about
it's
medical.
based on purchasing power, where the power of, instead of just being one district, we're the power of 13, 12, is that what you're saying? So we're able to negotiate better pricing because of that?
Yeah, so an interesting example that when we were first building the pharmacy piece of this out, we had a school district that took their pharmacy, their PBM out to bid, and they went to a direct OptumRx contract from the district to Optum at the buying power of, I think there were 1,400 people at the
Yeah,
time.
it's a similar size.
Yeah, so there were 1,400 people, and they went school district direct to OptumRx, and they got a price. And then there were all these other market bids, basically, provided. And then, as a comparison to that, we went to OptumRx for Health Trust, which is the big buying engine that Fleet's hooked to. And when you compared OptumRx Direct to OptumRx Core Trust, Health Trust, they've changed the name, Health Trust, there was a significant difference, but they were exactly the same formulary. So I always think of it as Health Trust is Fleet's benchmark. We've also had school districts that, when we came back with the Fleet benchmark of Health Trust, they really wanted to stay with Prime Therapeutics, for example. Well, if Prime knew that we were marketing them against Health Trust, they came way down on their price. They were still a little bit more. There were I think 3 points more. And the district did choose to pay the 3 points to stay with them. But that was the district's choice. That's why we say you have the choice, but it's more like an empowered choice than anything.
Informed.
Because, yeah, so in the other district where it was Optum to Optum, they were literally exactly the same. But the reason we got a better price through the health trust is because it was a whole different buying channel inside Optum. They have all these different buying channels set up inside these PBMs. And the really big one, like Health Trust, that we are bolted onto, that Fleet's bolted onto, is a different buying channel than the one that the school district could go to direct. And it was like a 20% difference. I mean, it was a significant
I mean, I
difference.
feel like this should be illegal. It should be illegal to charge different groups different amounts of money. I get the understanding of bulk buying, but this is kind of, that's
It's
crazy.
ridiculous.
So you're the actuary, right? Is it because there's,
No, he's chief of staff.
sorry, who was the actuary?
We didn't bring the
You're
actuary. No, ma'am.
Oh, okay. I was gonna,
Ms.
basically,
Ruddy, before you, I want to follow back up with Ms. Chong's question is, it is not just the buying power towards pharmaceuticals.
Correct.
You offer also stop loss and other services as well. So
Yeah.
this was just the example that was used, but there are other services that come along with being a
Yes.
part
Yeah.
of Fleet. I didn't want us to,
No,
because,
we're-
and I want to make sure
probably-
we're very clear on that, because we do have members of our insurance team here, and so I want them to understand that we're not just having this conversation around just pharmaceuticals.
well, I
Yes,
think
ma'am.
it
That's
is
just the
important
example.
though, because I think that is one of the concerns that members would want to know about, like, are you getting rid of my medication?
I
Is
agree.
my medication
Mm-hmm.
included? So I think we've asked the same question 7 times to make sure we're, like, different ways, so like, how could we get around that? I think we're clear
Yeah.
on that piece, but yeah, that was very important.
And just, there are other, we're gonna go into stop loss and other things. So, but ultimately, if we are members of this Fleet, and we identify that, hey, the prescription portion doesn't seem to be a benefit for us, we don't have to implement that benefit. If something changed down the line with these matrices, or is it all, we take all the benefits that you have and they are all, or can we pick and choose within them, saying, hey, we would like the stop loss, but we're not so much participating in the pharmaceutical?
Well, so you would see the Optum Health Trust, I think what you're asking is, can you just partially join Fleet?
In a way, just saying what Ms. Ruddy was saying, something about if the matrices change, and we're seeing that, from pharmaceutical side of this, it's not benefiting us the way we thought it was. But we maybe want it for the stop loss benefit. Is the membership all or nothing? Or can you à la carte the things you participate in within Fleet?
So, in the pharmacy example that you're giving, if it's not performing like you wanted it to, the reason you would know that would be because of the Fleet actuary telling you that. And then we would find the market answer that beats it for you, right?
Okay.
So we're not saying you must be in Health Trust. If you don't like that for whatever reason, or there's a better option for you, Fleet would place you in that. And you would know from the data that, and the independent actuary that's coming from Fleet, more than likely, the way you would learn that there's a better option is we would be the one telling you that.
So essentially, it's like we meet annually with a consultant about our health insurance. You're saying you're essentially, instead of a consultant, almost an extension of our team that alerts us more frequently than that yearly inspection a consultant might do.
Yeah, it's ongoing. Like
There's
the
actually a
data.
monthly report that you'll get on how the plans are doing from us
And
together.
the numbers, so basically you stated that we could reduce up to $277,000 already, so based on the medications that our faculty, staff, and everyone has, so
Yes.
potentially, so it's
Mapping
showing
numbers.
that already, that's what we're taking.
And that's in pharmacy alone.
Yeah. Yes.
Which was greater in the stop loss.
And so you're aware we have a new health and wellness center, so I'm wondering, I just have a few questions with that. So how many other current districts, if you are aware of, have something similar that we have? And then could that potentially, have you seen anything change with, everyone getting healthier, right? So, because they're going to the clinic, they're getting their physicals, they're taking the right proper medication, maybe changing from 5 medicines to 2 or 0. then that could change things as well, so.
We see a
any
lot of
information or
success.
data on that?
We see a lot of success with that. That's part of the reason we want all the data coming into your warehouse, right? So we can monitor those kind of things. But we had a particular school district had about a 30% participation in the clinic. They had a clinic. It wasn't driving to what their claims were indicating. It wasn't treating what their claims were indicating, and they didn't have very high participation. So we rolled out, it took 2 or 3 years, I guess. We rolled out an entire change management campaign, communication campaign, adjusted the way the clinic was providing services to target specific conditions. They had a blanket statement of metabolic syndrome. We get a little more granular in the way we look at it because we look specifically at blood pressure and BMI and that kind of thing. But the last report I saw last month, matter of fact, participation's north of 70%, and they have saved millions of dollars on their claims, not just the medication side, on the actual doctor claims, the physician claims of utilizing the clinic. That particular clinic model is also being evaluated and customized for Polk schools right now, as we speak, Polk being a member of Fleet. So when we see a best practice like that, we bring it to you immediately, and we can look at your data to see if it's applicable. Not everything's going to be applicable to everybody. You know, a robust clinic structure that someone like a Polk could build out, Lafayette County schools could never do that, right? I mean, it's just they have 200 people, 200 employees. So not every solution will fit everywhere, but we try to make sure we are up on every solution.
So it is a model that you work with when we have our own clinic, and it is something that still can drive savings for us that you can find improvements in.
I would argue we could improve what you currently have.
Mr. Ouellette, is there anything in our marathon contract that would prohibit a collaborative relationship with a third party?
There's nothing that prohibits it. I mean, and Marathon's been pretty good to date as far as having discussions as receptive to, even inside of what we've been doing. If we are looking at changing process or, I haven't run into a wall with them. And there's nothing in writing that would put a wall there.
And Marathon does already provide data to the database for Fleet schools, so we've built that bridge already with Marathon. So the exciting thing is looking at your medical data, your pharmacy data, and your clinic data all together on your population.
So I just want like a real world example. Like, let's say I'm going to get an MRI, they want to bill the insurance $10,000. So how does Fleet help with that? Does that make sense?
Well,
Do you
that-
negotiate that price? Or?
So I think it would benefit the board probably. Fleet, really, if we're looking at it, and please correct me if I'm wrong, is really more so looking at savings as it's connected to PBM and risk/stop loss, right? As it was explained to us, that's kind of the two major branches of this tree. And then through a partnership, should we go down this route, you guys would also facilitate selecting a broker who would then assist with medical carrier, dental, and vision. Am I barking up the right tree on that?
The medical carrier, Fleet could also handle your medical carrier. If you
Good.
think of it more in terms of, is the board paying the bill or is the employee paying the bill?
Mhm.
Because we operate under Florida Statute 112.08, meaning if it's board funded, Fleet can touch it.
Okay.
If it's employee funded, it doesn't fall under 112.08, and that is a different scenario. But to your example about the MRI, what Fleet would do is we would find the best solution to drive the care to the lowest cost MRI. We would not be directing them. We manage the industry contact. So we would say, okay, which carrier has the best toolbox to drive your employees to the most efficient MRI? But then the trick to it is, we're not relying on the carrier data to tell us if it's right or not. It's in your data warehouse. So the carrier would say, okay, you need to go to our magical Blue Book MRI app. Okay, the employee would look that up. It would say, go to MRI Center number 2. Instead of 10,000, it's 8,500. Well, that all sounds great, but you don't really know how the data bears out because the carrier's delivering you the response. The carrier's bringing you the ROI on that
Right.
tool. What we've done is we've pulled all that raw data into your warehouse. So when we come back, we'll tell you what the ROI is.
So you're comparing it again, instead
Real
of us
numbers.
getting our micro database searching from what the carrier's providing, you're comparing that against everybody to determine if that was really the best choice to drive that,
And it's
that
because,
number.
it's because we have all these school districts' data going into the warehouse.
I see.
So we're able to, it would be more correct that we could tell you what the best answer is, and are you getting the best answer? Versus steering, we being the group that steers somebody to that MRI.
So I guess, looking at it right now, your current makeup, how many different brokers are currently involved?
3.
3, okay. And so we have one at the table now, and there
No,
are 2.
He's unique to Fleet. He's only the Fleet broker. He does not operate at the district level.
Okay, all right, so that's what
And
so
he
in other
gets a
words,
flat rate. There's no backdoor commissions on his.
so this isn't
contract.
this isn't the preferred broker that Fleet brings with them? that-
There's not a preferred broker.
That's what I'm, okay. So in other words, one of our districts, well, we have Florida Blue, down the road could be Cigna. So we're not saving any money that way by pooling our resources and going to the actual medical vendors and using our power of size to actually help with our medical purchase of
The ASO fee?
yeah.
Yeah, that is something we're looking into. Every single part.
But we
of the
don't do it
program-
now.
Not currently.
Okay, so what we do now, I'm just trying to understand, so when we move forward, if we signed up here, what it would look like is, you would help us with the RFP for our broker. So, we would maybe, if the RFP worked out, we'd keep Brown and Brown. If not, we'd get Lenny's broker, who knows? All right, so, a different broker. And then, we would either possibly keep Florida Blue or we'd roll over to Cigna. That would change, that would all, the vision change, and all those things, those individual buckets for our healthcare would be within our realm of authority.
You have full autonomy of your plan design.
Okay.
You just get to see maximum pricing leverage.
You're gonna show us the pricing levels based upon the negotiation at scale.
We have all 4 BUCAs participating right now. We have Florida Blue, United, Cigna, and Aetna. We have districts with all of them. We have 3 different PBMs, 15 different stop-loss carriers, all participating at the fleet level, meaning they're going to get really sharp on their pricing because they realize,
We're all seeing each other.
yes. And it drives, the transparency piece can't be overstated. That level of transparency, especially with the data warehouse, what your program's actually doing compared to other programs, that level of transparency squeezes out so much. I don't want to call it, I'm going to be careful what I call it. It squeezes out a lot of the unnecessary cost.
Right.
And everything that Fleet charges is a flat PPM, so there's no motivation on manipulating anything.
There's a flat fee per membership?
Yeah, so it's more correct that we would try to tell you the lowest cost instead of inflating it based on a commission protocol.
I just kind of wanted to put that out so
No,
that
that's
everybody
a good
understands
question.
that we're not buying a lockstep,
That was.
more a la
that-
carte.
When we first started designing this program, the big program of Fleet now, one of the very first things, we sat down with a lot of superintendents and board members and CFOs to try to determine what do they really want a program to look like? Because everybody always says, why can't we go together and solve the health insurance problem? Well, it kind of baffled us too, why it hadn't happened over the last 40 years.
Yes.
So we started asking, we just sat down with CFOs and procurement people and regulators and everybody and threw it out there. Why won't you do this? One of the things they told us was, along with the logical stuff like transparency and accountability and all the things that Fleet delivers, but one of the things they told us is we need full autonomy. Because the way it had always been built before was on the back of an interlocal agreement, meaning if I'm a school district and I have Cigna and you want to join with me, you have to take Cigna. You have to use my contract. That's how an interlocal agreement operates. We took it out of the interlocal agreement category and put it into 112 trust definition. When you do that, that allows every school district to maintain full autonomy of who their carrier is, who their PBM is, who their stop loss carrier is, all of that. It's all right there for you to look at. And we've got, I think you said there were 15. Is that what were there 15 stop loss carriers?
Yep.
That are all competing, but
What was the third PBM? You mentioned 2. Did I miss the third one? You said you had 3.
well, there's a lot, there are more PBMs than just those 3. There are 3, I believe, that we are using.
Yes.
We're using-
Prime Therapeutics is the other one, that's Florida Blues.
And Welldyne. Polk's using Welldyne.
Express Scripts,
And-
Cigna's,
Mhm.
PBM.
Real quick on the topic of PBM, should we make the move and go forward with it, before we were to do that, would we be able to get a disruption analysis to see truly if it would be 1% of affected employees?
Yes.
We would be?
Yes.
Okay.
Yep.
I believe, so a lot of your services involve some administrative work that we already have either contracted to do with Marathon, or we have team members who are currently doing. So my understanding is there would probably be some overlap based upon the timing that we enter. You said there's flexibility amongst the timing, but, you know, the signups for health insurance, you know, happen in a defined range of time. So I'm sure there would still be overlap in some way. Can we get a better understanding, and Mr. Roulette, if you've kind of grappled with, well, technically we would have a dual administrative level that we would be paying for a while until we could pull some of those back in order to hand those items over to this group?
I don't think there's any, I don't think we dual. We're coming up, we had the discussion, we're moving into the spring with our RFP. And if we moved forward with Fleet, then we kind of move with them into crafting what we're looking for in our next broker. And so the broker would keep in rhythm with our open enrollment, and then our selection of you know, what's already existing contracts, and then the new contracts that'll come up before we get to open enrollment.
Yeah.
I don't think there'd be any,
I'm thinking more of like when they say that they will do the performance audits for us, so those are things that, you know, our team no longer would have to do, or, what was the other?
those are some of the things that actually, you know, right now, I mean, our broker does. Okay, so,
I see.
those are the, so that would be
So that's kind of
crafting exactly what we're expecting of the broker, and some of the discussions, and correct me if I'm wrong, is what the broker has to go ahead and share with us in the process. And because, you know, brokers make money too, and, you know, when they come to us with a selection of, are we going to go with Florida Blue, or are we going to go with Cigna? Sometimes there are, you know, different places where they're not necessarily our fiduciary.
Yeah, the law's pretty clear on that. Being licensed agents, they're the fiduciary of the carrier.
Yeah.
There's no way around that.
And
Of the carrier.
regarding timelines in general, if I'm not mistaken, I believe our current contract with Brown & Brown for brokerage, I believe expires January 3rd of 2026. So these deadlines and things are coming up a lot quicker than we probably think. You know, it's like the side view mirror, you know, it's closer than they appear. So that's something to keep in mind as we talk about, if we do go in this direction, what would that timeline look like? Because we do have a existing agreement that is expiring here January 3rd.
And don't we have to, like, some contracts have an automatic renewal 30 days before or something? Does
We
that
are,
have any of that?
we are at our final extension for this contract with Brown & Brown.
Okay.
Some of the administrative things, for example, who does your 112.08 filings?
It would probably be Brown & Brown.
Okay, so that's something Fleet would now start doing. I'm assuming, are you looking this spring to run any voluntary procurements? Are you gonna want a broker to do that?
We would want the broker to do that. We're already in conversation with our current broker regarding voluntary.
Okay. So that would help define the timeline, right? What Fleet's able to do on a broker procurement, because we fall under different statutory provision than a school district or a county or city does. What we're able to do is, and we're currently doing this with 2 of the Fleet members, is we can run a procurement for you for your broker, and we've done them as fast as 30 days. Where if you did it the statutory way under your processes, you'd be looking at 90 to 120 days all in, from start to contract. We can do them as quick as 30 days. We just have a different allowance under statute on the process. It's still fully transparent, you still get full documentation. We can just run them quicker. So but you are correct in thinking that there are going to be some, in full transparency, there are going to be some administrative overlap during the transition. But where you are in the process right now, I think, to Robert's point, I think it would be minimal what that looks like. We have successfully, we haven't made it public yet, but we have successfully renegotiated a PBM midterm and saved, what percentage did you tell me? 6%. In the same existing contract with the current PBM, we just renegotiated contract terms. And the PBM was very, very accepting of that, because they know the other side of that outcome, if they don't do that, is we're gonna market them. And then they risk losing it all. So they came back and reduced, across the board, a 6%, and that worked out to be, that's north of 7 digits, if my math is right, on this particular group. We went to another PBM and told them the same thing, and they pushed back and said, we're not gonna renegotiate. So the board directed us, okay, then bid it out this spring. The pressure that comes that we're able to deliver is pretty.
So let's dig into what is the cost of this utopia, right? So where do we, I see that you have this breakdown between our current state, CVS and Optum, and I see some of these administrative fees and such. Is that administrative fees, consulting fees, are those your fees?
That's
What's
not
the
Fleet's
cost
fees.
of the access to the special country club?
It is $22.25 PEPM. And we take over, there's a list of high-level scope of services in there of all the things that we take over. But, an example would be, you don't have to go get your own data warehouse. You really should have your own data warehouse to have pristine data. But you don't have to go do that, and you get it a lot cheaper because we're buying it on scale.
And that price, does that change if our enrollments drop or increase substantially? Or
If it increased
or a certain
substantially, it
threshold?
could go down, because it's priced by, there are 4 tiers of pricing.
Okay. Do you have those tiers of pricing somewhere
Not
for us
with
to
me,
look
but we
at?
can certainly get it to you. And that, just so you know, that pricing was established, it was established and approved by the trustees. We don't decide that. The trustees set that and establish it. The other thing, joining Fleet, so you would have that rate, and I want to think you would be at a $10,000 start fee, and that's what builds the connections to the data warehouse and all that kind of stuff. So there's a one-time.
like a startup
Like a
implementation
one-time
fee.
That's
implementation
what I was
fee.
gonna ask, was there any startup fees and then an annual, in addition, like an annual fee?
There's not an annual fee, it's
So no
just,
annual fee, but potentially like a startup fee and then the 22-25.
that is correct.
I know you've been growing and, kind of restructured, but do you have any historical data in terms of your percent increase year over year? Like, is this gonna be $30 next year?
Oh, that rate?
Yes.
That's not up to me. It's whatever the trustees, the superintendent's trustees decide.
So what was, if they were in the group last year, what was the increase this year?
There was not one.
It was flat.
Mhm. And as far as I know, because you're referring back to the FISBIT number, and as far as I know, that was flat forever.
Time, yeah. 9 years.
I mean, I never knew them to change that number.
Okay.
And when you compare our fee to other consortiums that, they don't offer health like this, but they offer property and casualty and things like that. They're all, the closest one I found to this, the lowest one to this, was $26.75. And that was for property and casualty.
So from this point, is there more benefits you have in your presentation to share outside of this here with stop loss, or was it just the?
The only one that we have a sample of what the result would be is the pharmacy.
Can you bring back some more examples? And whenever y'all come back.
We typically see about 10% savings in stop-loss premiums. Sometimes it's greater than that. So
I
if
think
we
that's what you
did
presented
that
the last time,
Yeah.
right? That there
Yeah,
was an
that's-
estimated
Yeah.
close to 1 million.
Take the current premium, take 10% off that. That's typically what we see.
And
It could be greater.
And we,
So what is 10% of what we currently have? What do we currently have?
I think we looked it up, and I think there's 700, just under 700,000 in premium, I believe, on your stop loss.
70,000 maybe.
And you are, through that stop loss, that's a reassurance that the trust is purchasing for that stop loss? Or are we purchasing that policy directly for the district?
It's for the district,
Okay,
for
but-
your plan.
Okay, so, but then you brokered basically that reinsurance for us at the 10% discount? Is that what you're
Yeah, it's,
saying?
isn't the contract written fleet/district?
Yes.
On the stop loss? So you're getting, if you think of it, you're getting the stop loss for your individual district, because every district's got different attachment points, right? And once again, wanting to maintain that autonomy, if you want an attachment point of, I think yours is 275, is that right?
Yes.
Isn't that what we found? So if you got an attachment of 275, and you wanted to go up or down on that attachment, we don't want to do anything to hinder you from doing that. So the contract is written on your terms and conditions, but the contract is written through Fleet.
Okay, and what would be the risks of going from what we have right now to switching to Fleet? Like we've talked about all the positives, I mean, what can go wrong here? What are the downsides of this relationship?
Well, I would love to tell you I have a long list of things for you to be careful of, but we struggle finding things that are, I mean, because you can always leave. You know, this isn't a 10-year commitment or anything.
Yeah, that's true. I mean, that's nice to have that flexibility, but, you know, an organization like us to come and go is very costly. So when we make, you know, we have like an aircraft carrier, you gotta turn it around. So, you know, yeah, that is nice to have that flexibility, but sometimes the cost of changing it could be cost more than the benefit of the lower cost. And I'm just looking at that in comparison. I think what I think we really need to see ultimately is kind of a side-by-side comparison of, you know, how this, I mean, there's clear benefits here you've shown based on our data. But I think for staff, I think we need to really see a true comparison at some point so we can say, hey, this is what we're gonna save and how much is it gonna cost us in this transition? Because just like I said, you know, is it gonna cost us, how long is it gonna cost us to recoup the investment of the change through the potential savings?
So you're saying you're wanting the actual, not the per person, what is our aggregate cost fee for
Well-
them, and then less the savings of 270 if we chose that Optum plan plus the 70K stop loss? Because that's what they're telling us, they're predicting maximum $340,000 savings.
Well, what
Yeah, but
I'm
I
saying
think
is
what
for
he's asking
staff is
something
saying
different.
that, you know, from Brown and Brown where we are now and Fleet,
I think when I think about risk, is first looking at what additionally will it cost us if we were to go into Fleet, right? There is going to be a natural increase, right? So we anticipate that, we know 10,000 to that. When I think about risk and the conversations we've had is that what we know is that we can't stay where we are. With staying where we are, we can anticipate what we have experienced the last few years, and that is some type of increase ranging from 7 to 15%, right? If we just kind of, somewhere around there, right? Maybe 7 to 20% increases that we can anticipate, and then as we get closer, we can kind of start to see where that's gonna fall. I think the risk of going is going into something that's a little bit more unknown, and maybe our savings aren't 10% or the 7 to 12% that was there, but not necessarily the risk of it being worse than if we, were to stay. I don't think going in is going to put us in a worse position than where we are currently at
I think we have
So-
to clarify, this is not the bidding or the choice of what is our healthcare premium next
I
year. We're
agree.
still gonna have to go through this.
Yes.
What this is do we want to enter this greater consortium at a per person fee in which we will enjoy estimated decreases in our pharmacy and risk benefits, but it doesn't mean that we're going to not have to do all that other work and pick the health insurance plans and perhaps still get an increase, but it wouldn't be potentially as large as the increase we're gonna see right now. I mean, we have a situation right now where if certain bills are passed at the federal level, we're gonna see less people on health insurance. When you have less people on health insurance, that means the rest of us are gonna pay more. You have tariffs where in Sweden, they're making the knee replacements, those are going up 40%. So we have a lot of unknowns there too. This is the first thing I have seen that has even breathed the possibility of saving a quarter, right? Saving some money in relation to healthcare.
Yeah, as presented, I agree with you, and, I'm always wary with actuaries, they are a best guess, right, a very educated guess, statistical guess, but I have seen actuaries given to us in the past that were not accurate, right, they were off, and I know there's a margin of error, and what is that percentage here in these numbers, because, we're gonna be looking at these savings here to justify a change for cost savings and maybe efficiencies and other things that we're gonna factor in. So, I'm just saying that from, on the go forward, I wanna see what we're giving up and where we're going and what it's gonna cost in the middle to do that. Similar to like when we did the wellness center. We knew there was gonna be an upfront investment, but then we had to reach 30% participation and certain benchmarks that we would recoup that. That cost was now, it wasn't an expense, it was an investment in keeping premiums down in the future, all those type of actuarial factors. So, because my only concern is once we commit to something, that's it for a good period of time, because it's not like we can just say, okay, we had a 30-day free trial, and then we're going to back out. It's just, we have to go all in if we're going to switch. So just to keep that in mind, I just want to see that side by side.
We all want to save money, but I think I'm just wanting to see like more objective data, kind of like what you're saying, like this is it, this is where you're going to save, and I guess right now.
Yeah, and is it really saving? Are insured benefiting from this? Are we giving up services that we're paying for? That is our level of service going to go down because of this? Is it going to be increased? These type of matrices, because again, we can always look at the dollar and cents and cut, but at the end of the day, we also are offering a product here to a pool of customers, which are our employees, and they have to want to buy it, right? Because if no one's buying our insurance, then our self-insurance program falls apart. So I'm just keeping all those things in balance in the decision-making.
Sure.
You know.
If I
I
can
also
compare
would
it
like-
to like, I think about it from the lens of when you as a board were making the transition to Neola, right? These belong to you. It's gonna be your broker, it's gonna be your plans, it's gonna be all of these. This is an additional group that will be providing some oversight, things for you to look at, bringing data before you, but not saying to you, you must have it this and you must have it this way, right? They're going to outline, here's what the scope of work is within our agreement. They're going to support with the RFP to make sure that our broker has these pieces. I think that we can definitely find risk, and we can bring some more of this information to you as to what the actual cost is. I think when we began the conversation is what the board is in agreement with is that you want to ensure that you can make the health benefits an actual benefit for our employees. And I think this is a part of that conversation as we look at how do we make benefits an actual benefit and how do we ensure that they're also affordable for
I
our
would like the
workforce.
board to make a definitive list of the data they want, because this gentleman has already come here, has already provided information. We asked for additional data, so this is the second return. We've been having conversations, I think, we reached out in January of last year. So this is not a quick kind of decision thing. I'm wondering, is it that we need to see a sample contract where we can identify and make sure that what they're presenting here is that, yes, we have the freedom to choose our health insurance plan. Yes, we have the freedom to choose our formulary so that the care and the prescription benefits do not change. And essentially, the benefit is, the way the cost savings are realized is by aggregating all of us in a smaller way to be able to negotiate in a larger way. And to see what is this overall price based upon, okay, what if we have our current insured pool enter? What if, let's say 75% decide they can only afford insurance and 25% of them are gonna drop next year? How does that change that per cost? So I think we need to define specifically what data we want them to bring for us to make a decision so that we can, move forward confidently.
Well, what I'm asking for, not for them to bring back more data.
Okay.
What I asked for was I asked staff, I was giving staff direction, saying I want to see where we are right now. If we stay with what we have now, can what we have now accomplish the same things without a change and all the things that come with that, right? Or against what Fleet is proposing, so that we can say, is this worth changing? It's, for example, like when you get down to the numbers in anything that we do in life, even in our personal lives, we look at you might save X amount of dollars, but you're like, that's just not worth my time to do that. So I'm saying, let's look at what we got now and have a clear, I want a clear view so that we can make an informed decision. I do appreciate the extra data, and I think this was very well presented today. I'm not saying anything against that. And I pretty much understand the scope of what you're offering there. But it's more or less for the board to have a clear comparison of what we have now and what is being offered in its place and what it's going to take, how much is it going to cost us in time, effort, resources to make this transition, and is it that effort worth the savings, right, to go forward? And how, because if it's going to cost X and it's going to take 3 years, again, I'm just throwing these hypotheticals out here. To do it, is it worth the change if we have, the cost to change takes that?
So you want a business cost and internal utilization analysis to determine what it would take, but not on what you think that it predicted, because what I'm hearing you maybe say is also you're looking for, well, what would our what's our proposed health insurance premiums for next year? But we don't get those we don't go through that negotiation for quite some time, and potentially if we make this shift, we wouldn't really.
Well, I'm based on the data we have available to us today. We can only make decisions on data that we have. We can forecast, and I'm sure there's some actuarial data that we can look at on where premiums. I mean, we just know that every year that the answer is they go higher. So, I mean, and so it's just by how much or how much can we keep it?
Aren't we doing an update, is it at the 28th meeting? Is it the October 28th, or is it?
I believe it's November.
November.
So-
We bumped the update for this meeting.
Okay, so at your November meeting, so a month from now, we would be providing you with an update on some of what you are asking for, but looking at the wellness center, looking at the changes that you made to the plan design, which, how did that work out? Did employees shift and make some of those changes? So that is gonna be coming before you. For me, we can definitely start to get these, we can grab this information and bring it forward at that time. I think we have to also consider the fact that we are going into a critical step, which is going out for RFP for our broker. This is by no means saying that our current broker has not done an amazing job or that they will not end up being the individuals, but if we are going to be going down, if you're going to consider fleet, we also need to make sure that we're considering that in lock and step with us going out for RFP, so that we do not have anything in our broker contract that will contradict our ability to go into fleet, is
So
what
that
I'm.
a timing thing?
It is
So-
definitely a
so-
timing thing, and we will bring some more information about a possibility of month to month, with our current broker beyond that, and see what we can get back for you.
And I
And
wanted
we'll
to
see if we can
add-
bring it up. Let's see if we can shift up the presentation from November to the October 28th
So
meeting.
when would be the latest that we could put the RFP out and still be in alignment for everything else that follows it?
I don't
90
want
days?
to. Patty, is Peter here?
It's about a 4-month process, so we would most likely have to go month to month until it's complete.
Yeah.
Okay.
And so remember, several months ago when we came first, and prior to them coming, I remember the board, we talked about how can we combine the, different districts, and, in the past, no one would take us, to help decrease. So I think that's how this all started. And from my understanding, I know it's not really changing anything, but it would just be an addition. So we have a broker now, but if we took on fleet, we would also obviously have a broker, but the addition of the shared risk and cost savings. So I
Well,
think.
if, just on that, is it, so I'm just understanding this correctly. So whether or not we kept Brown & Brown or went to another provider, this would complement anyone else that we
Yeah.
would do. Okay, so my only struggle right now is, again, and then this may be a timing thing, is that what are those other brokers out there going to offer in comparison? Because right now, we're just comparing it to what we have right now.
We still will go out for RFP for our broker. And they would still, whomever is out there that would want to be considered will still be able to do that. We would just have within our RFP some additional things potentially that we haven't had before, including like you must work with fleet, in these processes.
But I'm just, the data that we have, that we're pulling from in our data warehouse that you guys have run this against, is based on the way everything is right now with Brown & Brown and that relationship right now, correct? Am I understanding that correctly?
It would actually be a simpler version, not a more complicated version with the broker, because, and I'm saying this because we've now done this up to 12 times. So what winds up happening is, if you imagine the broker has this long scope of services, regardless of who the broker is, you're going to take half of those and give them, fleet's going to be doing that. for example, you're not gonna need the broker to bid your PBM anymore. Fleet's gonna do that. You're not gonna need the broker to do the 112 filings, the data warehouse, all these things that they're currently providing. So the contract with a broker becomes much, much more simplified, and it's a much lower obligation and responsibility. Primary thing that the broker will be doing is the voluntary, which is why I asked that question earlier. But yeah, it's not, and it's a other than, not in addition to, is way to think about it.
And shared costs with other districts or?
Our costs would be shared. The broker, whoever you guys would eventually select, the way that works inside
Help-
Fleet.
help.
Because
I mean
but
help.
our cost is not shared. I just want to, right, because I mean, that's not actually what's happening here. We're shared for it's shared on your side.
Claims are not
Yeah,
shared.
not
Right, our
shared-
claims are not
yeah,
shared.
not shared
Yeah,
with
this
other-
is, because that's what you were talking about earlier, like we tried to go with the sheriff or with the county, and this is not a pooling of claims. But this is giving us more buying power with prescriptions and with stop loss, getting a better rate, and it's buying power, but also you're saying because we're getting more real-time data from the warehouse.
Right, so even the cost of the data warehouse is cheaper because you're buying the data warehouse on 25,000 people, not 1,200. The cost of the 112.08 filings is cheaper because it's one contract for everyone. So there's a lot of these administrative services that your broker's currently providing are going to be done cheaper through Fleet by default because it's being done on a larger group.
And the broker doesn't provide the health insurance. They just are the ones who are the third party, you know, just like if I go down and I go walk into the Allstate office, that person that I work with doesn't provide me the insurance. They may say, okay, well, an insurance office, they may give me a quote for Allstate, for Progressive, for Geico, right? They're an independent agent. So I could get those prices from other brokers. I can get that health insurance from another broker, right? I don't think that means that we're tied to that broker, even if we wanted to keep our same plan.
I guess I'm just saying is that it's the unknown right now. If we're going out for requests for proposal on other potential brokers, what are they going to be offering to us as a whole package, right? Because we're only comparing what we have now to how this would add. Could another provider already offer some benefits here that we would need Fleet? Do you see what I mean?
And I think the only way that you find that out is to say, we're gonna go out for our RFP, and then, you know, we'll talk to you.
I'm almost like, are we putting the cart before the horse here? I mean, should we know what we have as our broker before we go on with Fleet?
Well, yes and no, because I mean, what we need to find out is, because then we would run into redundancies. If we, you know, put a broker with a standard RFP for where we are now, okay? There's a lot of actuarial work that Brown & Brown do for us, okay? And I don't know, I mean, I'd love to see a sample RFP of what you've been doing with your folks as far as when you get their brokers together, because what pieces are coming out of their bid for service, because I'm sure that has a huge effect.
If I can, it'd just take me a second to explain that. So when you come into Fleet and you tell us, I want to go out to bid, we call them contract effectuators because they're no longer brokering anything for you, meaning they're not making a profit. There is no way that in the private sector solution outside, you got to kind of try to keep in mind that Fleet is a nonprofit owned by school districts. So there's not going to be a private sector broker solution that can outprice this. It's mathematically impossible because the brokers have to make a profit on top of it. So being a nonprofit fixes that. Now, the way the process would operate is once you came to Fleet, we would bring you a scope of services. and I'm talking about a contract effectuator scope of services, that we're taking care of all these other things, this is what's left for you to consider that you want in your district or not. And you go through with a highlighter and you say, I want that one, I want that one, I want that one, I want that one, whatever the case may be. And then we take that scope of services, and that's how we run the procurement inside Fleet. And then, for example, we're in 2 active procurements right now. Both school districts had 11 brokers respond. Well, one was 13 brokers, one was 11 brokers. Want that business. So the way it works is we take all their responses and we measure them against the scope to make sure, are they compliant? Check little things like, do they have a license? Do they have errors and omissions insurance? All the kind of stuff you normally would do. We bring that down to a list of finalists and then bring it back to you guys and say, okay, here's the 3 that meet your scope, that meet your scope the closest for the best price and meet all the required factors, being licensed, for example. So you still select your agent, but you're selecting the agent only on the scope that Fleet's not doing. And that's where we're seeing this big reduction in broker costs. One of the districts we work with, they're not a Fleet member, but we use the same methodology for them on broker only, on the broker procurement only. They were paying, they didn't realize they were, but they were paying about $800,000 a year all in agent and broker fees. They didn't realize that, but they were. When it was all said and done, the contract was $300,000. Obviously, it's a big district, right, paying that amount of money. But the point is, the way you drive that savings is all defined in your scope. And the scope is a result of, are you in Fleet or not? Because if you're not in Fleet, the scope's that long that the broker has to do. If you're in Fleet, it's that long, because Fleet's doing all those other things, the actuarial work as an example.
Right, okay, so, I mean, I guess, I'm just putting some skepticism in, just because you have 13, 67 counties, right? Why has the district that you've presented, outside of, we're thinking about it, or not wanted to do this, or couldn't see this as a fit for their model? Has anybody rejected it because it just, the numbers didn't work out?
Yes, one has.
Yeah.
And it was Palm Beach Schools. And it was because they felt like they were so big they didn't need to join with anybody else. And to be frank about it, I'm not sure they might be right.
Okay.
But the
So-
reality is.
Because they have their own scale and.
They have 30,000 people there.
Right, so they already are kind of getting those benefits already because they have.
When
They-
you look at
they
the-
feel like they
the
are.
list, they're not the big, they're like the mid-size,
Mhm.
small, as I'm looking at the counties.
Yeah,
I think
well-
we have
All
some
right.
direction.
So-
We will.
All right, so,
Work with
board,
you
are
guys.
we good
Yeah.
with that? So we can move on? Okay, great. Well, thank you all very much. I
Thank you.
appreciate that presentation. Very informative. Thank you, Mr. Walker, Mr. Willett. Okay, so now,
We are moving to 12.01, which is Mr. David Fossardette.
welcome, Mr. Bassadet.
Good afternoon, school board members, Chair Furry and Superintendent Moore. I come to you this afternoon to discuss recommendations from our annual security assessments at each of our schools. As you guys are aware, state statute requires the district safety specialist, in collaboration with our public service agencies, to conduct safety assessments of each of our schools annually, and then provide recommendations to the school board on safety initiatives for the coming school year, for you guys to give us feedback on prior to November 1st. So the information gathered in our annual security assessments, we look at school data in terms of what type of school, grade level, student discipline information, as well as assessor information. As discussed in previous meetings, assessor information not only includes student discipline, but also criminal offenses that happen on school property, whether it's during the school day or not. So that is a little different than student discipline information. We look at school infrastructure in terms of utilities, the way we're able to communicate not only internally but with first responders during emergencies, and then additional things such as the school have generators to support backup power. We look at school security in terms of safe school officers, what type of cameras we have on our campuses, as well as access control. And then we look at prevention and threat management, how we report concerns that happen on our campuses, how we address threats or potential threats that happen on our campuses, as well as how we provide training to our students and staff in relation to all emergencies on campus. And then we do a campus tour. That's where we partner with our Flagler County Sheriff's Office, and they come in, not only our SRDs, but also members of their intelligence unit come in kind of with a blind eye and just walk around our campus, meet with our administrators, meet with myself, and they look really from a first responders and an emergency type incident with recommendations that we can look to implement throughout the school year. So after we've completed all the assessments, we do have areas of focus that I would like to bring to your attention today, and we have discussed some of these in more detail during our executive session in the past. But the recommendations that we're bringing to you for today is vehicle mitigation barriers on our campuses, just to slow vehicles down that are on our campuses, provide additional signing, both exterior and interior signage, not only to direct individuals who have a specific purpose on our campus, with where to go in terms of whether it's deliveries or the main office, or maybe one of our gymnasiums, but also to assist first responders if they were to report to our campus during an emergency. Again, signage on the exterior, but also interior in terms of where certain rooms are located and things like that. Make sure we have cameras in all areas throughout our campuses, and not only do we have cameras, but what type of cameras do we have, and what enhancements can we make to our camera system. Obviously, as technology is improving, every day we want to make sure our camera system is keeping up with those technologies. Making sure we have clear radio communications, again, not only internally, but also with our first responders. And then look at what type of response trainings are we providing our staff, and again, are we training with how to respond internally, but in terms of if there was a crisis that we had to, for example, we had to implement reunification, make sure we work with the county, the sheriff's office, the city of Palm Coast, because it will be all hands on deck affair, where we're all aware of who's in charge of what, who the incident commander is, where we would go, what does that communication look like, and whose role is what in those situations. And then finally is looking into some type of weapon detection system on our campuses, just to help take a proactive approach. And then the last slide, just as a reminder, we do get money from DOE in terms of school hardening grants. And as you can see, that money has decreased each year. We have not got this year's numbers, but based on the trends, we are anticipating about $171,000 for safe school hardening. And then we budget internally about $300,000 we set aside specifically for safety projects.
Okay. Any questions for Mr. Bossadet?
I just, for Department of Education and grant opportunities, I know, a couple years ago there was that grant opportunity for, essentially part of your role. Do you think, or maybe that's something you could look at for different, opportunities available to increase funding that they're maybe out there to help with any special projects?
Yeah, we're always looking into available grants, especially when it comes to security grants. So those grants are always out there, and that's something we're always keeping an eye on. Is
they're out there. It's just
yeah. Are we able to get them? Do we
guaranteed,
qualify for them, and what are they being used for? But that's something we're always looking into.
Thank you.
Okay, we're still looking into some of the other things we discussed as well, right?
Yeah, this is just a general overview, kind of summarizing, capturing everything in a general perspective.
So we had a robust conversation that was really helpful, and kind of one item that you and I spoke about, Mr. Bonsterdad, that was not presented at the safety meeting, and I think it's okay to share here, is involving the SRDs in more of a drug prevention discussion program, which it sounded like Sheriff Staley is very in favor of, and the SRD contract does outline that that is a piece that our deputies could be involved in. So I just wanted to kind of raise that as an item for the board that I think Mr. Bonsterdad, you talked about exploring that and bringing some options, or at least seeing where we could go with that. As our population increases, you know, our kids are going to be exposed to other things, and we just want to make sure that they're smart about it.
Yeah, so, and that's something I know our SRDs are willing to participate in, and we use them right now primarily in our high schools for our HOPE classes or our personal fitness classes, where we cover topics such as vaping and things like that. But I think, Ms. Ruddy, that goes back to the prevention and threat management section as part of this assessment, and looking at ways where can we utilize those even in a more formal version. I don't want to say like the DARE program, but the DARE program, for example, would capture some of those things to bring awareness to our students and our families also. It is just trends we're seeing, you know, nowadays, not only in schools, but in the community as a whole, because there are challenges we're facing.
What we see in the sheriff's office means that's happening in the homes of our students, and we have to arm them with that knowledge, so that's super helpful. Thank you. Yeah, I appreciate it, and I'm looking forward to the information regarding the collaboration with the county on some of those actions.
Okay. All right, thank you.
Thank you, guys.
And as we transition to the next topic, I do want to just take a moment. You can come forward, Ms. But just to thank our members of our insurance committee that represents staff and management for coming and being here today, specifically to listen in on some of the pieces around fleet, and I'm sure they will be back again when we have this conversation again later in the month. So I know we've transitioned from that, but I just wanted to acknowledge those individuals in the audience that are a part of the insurance committee, and them just being here and present for the discussion. So,
good afternoon, Chairman Furry, board members, and Superintendent Moore. I would just like to reintroduce you to Miss Angela Bush. She is our new finance director in the finance department. And Ms. Bush and I are here to answer any questions you have on finance consent section 7.
Okay, we're at 7.01, request board approval for Imagine Charter School financials. Do we have any questions for staff on this?
Ms. Wormack and I just already touched base. There's some inconsistencies in their reporting. Reporting some things as decimals, other things as percentages, not really highlighting the subtotals as opposed to individual line items. Sounds like she's going to work with them. They're in transition, and
they have just recently transitioned to a new software platform, which has been causing some issues with getting the data exported. I do know I've had some conversations regarding that with their regional director, which has created some timing issues with getting the reports to us. But I will forward your concerns and discuss them with him.
Okay, great.
All right. Well, that moves us on to 7.02, request board approval for purchase orders over 10,000.
For the Brain Pop, Language Tree, and the VMware, for that, is that a multi-year or annual?
Can we do one at a time there?
Yeah, I think they're all, so if you look at Brain Pop. Okay, so annual, so thank you.
Okay.
And for our cake funding, I was just curious, because I saw for Indian Trails, which industry is that being recognized for those cake funding?
Can you tell me a PO number and the page, please?
I just copied it and put it on my spreadsheet. I have to. So it's Certiport. I know our high schools use cake funding, but I was just curious for.
Sure. Yeah. It's the big for their certification, for the industry certification.
Oh.
Yeah.
That's for digital information technology.
Yeah. Yes. That's what it is. That's what he was coming up to say, that it is for our digital
Yeah.
information technology.
Exactly. So they also have the opportunity to earn certifications which allow CAPE dollars to come into their programs.
Okay. Thank you. That's all I had for 7.2. Thank you.
I just wanted to pull out and outline for community members that they may see some, and this is for the PO one, right? I always get the PO and the vendor messed up. That there are line items there for the sheriffs. They may ask, well, we have all our SRDs and we have the floater, what happened to that? So this is a portion, Ms. Wormack, you correct me when I go off the rails here, but essentially we help offset the extracurricular activity costs in some way for both FPC and Matanzas.
Correct.
And that, that the floater's already in place and was in place for that month of August, and so these are still those fees over and above, right?
Yes,
Okay.
every year we have always assisted the high schools with $7,500 each of athletics. And what we added this year in discussions with myself, Mr. David Bosserdette, and the two high school principals was the need to have additional SRDs at the larger events,
Mhm.
such as the Potato Bowl,
Right.
basketball games, which tend to be very large, and also homecoming. So those were added, and obviously the Potato Bowl funds will flip depending on what school hosts
Sure.
it each year.
Okay. Yeah, and you know, the game was delayed, could have, you know, got some tensions rising, but everything
Got a
went
nice
smooth.
rainbow.
Yes. Thank you.
I do have a question on page 2, the DACG Inc. Now, that one says to replace damaged canopies at Rimfire, is that right? And it's, but it says it's related to Hurricane Milton. Did we make any insurance claims for that to be covered for insurance or hurricane damage?
Yes, sir, through insurance and for FEMA. But
Okay.
we still have to obviously repair that and have that fixed.
So are we still in the claims trying to collect on that?
Yes, sir.
It takes a
Okay.
couple years.
Yeah.
We actually just received a check, I think, from 2017.
Idalia.
Yeah, Idalia hurricane.
Wow, I mean, I'm not surprised, I just got done with mine, and that was from Milton too, just so, I mean, they don't pay out quick, so. Okay, good. I just wanted to make sure that we were recouping that through, or at least we put the claim in.
Yes, sir.
Right for it, okay,
Yep.
thank you.
Mhm.
Any other questions on purchase orders?
Maybe just explaining for the public the First Baptist PO.
Sure.
What page is that on?
Page 9.
9?
So for the First Baptist, this is the thought private schools proportionate share of Title I funds. So how this works is they are allocated a certain allocation based on a formula from the state, or based on, I believe, on their enrollment as well. But all of the POs are done through the district to ensure that they're being spent properly. And so Ms. Tima York's group does the POs. And so we do not ever send money out to the private schools. They just receive the services.
Thank you.
You're welcome.
All right, so we'll move on to 7.03, approval for vendor payments.
I have 2, and I actually put page numbers on my notes going forward. So, page 2, so for the Flagler County Ed Foundation, I just wanted to know, is this like type of annual funding transferring, like?
Sure, I had
payroll?
Ms. Ruddy asked the same question, and that is an actual error. If you look in the coding, it has an R instead of an E. So when this report was recreated by my new staff, the revenue was selected instead of just expense.
Okay.
I have already reran the report, and I will get it uploaded after this meeting.
Because I've never seen it, and I was like, oh, maybe it's something.
Yeah, I didn't
Okay.
change it yet. I wanted
Okay.
to be able to explain it, but what that actually is reimbursement from the Ed Foundation that we receive for their quarterly payroll billing.
Okay.
So when I upload the new report, that
It
will be gone.
Okay, thank you. And then page 3, I was just curious, Brisk Labs Corp, 24,000. So the service provided, is that like for STEM curriculum? Page 3, Brisk Labs.
That is
That's
that's,
curriculum?
yeah.
It's
software.
Software for
Brisk AI is used for our
testing?
secondary
Okay.
schools.
Okay.
So it's a AI platform that's targeted towards education and specifically like secondary schools. So it's being used at our high schools.
So like Magic AI, but for our
Correct.
older students.
Correct.
Gotcha.
All right. Thank you.
I do have a question. I think this one's for Mr. Reeves. Are you still here? Yeah. The Sion Systems Fraud Detection Company. Ms. Warbeck said, I'm sorry, I missed it then.
No, just got the email.
So CTE grant, that's great. We didn't really have to pay for it. I'm just curious.
This is our CAP grant, actually.
Okay.
And so that was required with our fleet services. It's video and surveillance cameras that put on our vehicles, just like we do
okay.
other vehicles within the district. So it's just for security purposes.
Okay, I always try to Google the company first to see it, and it said fraud detection. I was like, okay, so security makes more sense on.
Yes, ma'am.
Okay, great, thank you.
Yes.
Okay, so that moves us on now to approval for deletion of inventory. Just one thing. Truck. Dry freight. Okay, any questions here? None, I'll move on to 7.05, board approval for finance budget amendments.
The engagement center utilities and the water, is that a one-time fee, like establishment, or is this gonna be a recurring annual?
That cost is for the whole fiscal year.
Okay, thank you.
Okay. So we'll move on to 7.06, board approval for district financial statement.
The class size reduction, was that an error for the 4,700%, or is it, I wasn't sure, the overage?
It's on the wrong line. I'll fix that. It
45.
should be on the line right below it, I think. I think those two numbers are flipped. The 12.8 million, that's actually the class size budget, and the 45,000. So I will
Okay.
get that fixed.
Okay, so it's, okay.
The 2 million should.
2 point, yeah.
We have received up to 12.8.
Okay, thank you, that makes
I
more
did,
sense.
and I can tell you what happened. I had to delete something, and instead of deleting the row, I deleted
Yeah,
just the
I've
cell.
done that a lot.
Yeah, I just,
Yeah.
I was like, it has to be an error, but I needed to.
No, thank you. I'll get that
No,
corrected
that-
and uploaded this afternoon.
No, that's all, yeah, no, thank you, and I'm gonna be putting page numbers on so to help with this, so thank you.
Good catch.
All right, got it.
All right. And then that was the last for finance. Thank you, Ms. Womack.
Thank you.
Thank you, Ms. Bush. And we'll move on to academic services, 9.01. That's Mr. Reeves and
Thank you.
this is for core ELA instruction materials.
Correct. Mr. Furry, board members, Superintendent Moore. Just bringing before you our next step in the process, and the timeline is before you today. And where we're at now is at the October 14th date. We'll give you an update on the public comments and recommendations of the materials at the agenda workshop. And I'm going to turn this over to Ms. Frank. She's going to kind of share the details of both of those events and our recommendations.
So the next slide, please. We'll give you information. So we, both Ms. Everidge and I, who apologize for her absence, she is under the weather, we met our committees last week. So our adoption this year was unique in that it kind of went over 2 school years. Typically, we do it within 1 school year. But our teachers were able to review these materials in the spring of last school year. If you'll follow with me for the K-5 column, I'm very proud to say we had 528 teacher rubrics completed
is
for the
amazing.
K-5 adoption.
That's really good.
It was, yes, well done.
Way to go, teachers.
We had 10 parents who completed rubrics.
Mm-hmm.
We were able to capture through our technology, the way they built the page this time, we had 157 hits on the web page where community members, parents could go on and view our online access. The 157 hits does cover the K-12. We weren't able to discern, what program they reviewed and what grade levels. However, we were excited to see 157 hits. For K-5, our committee met last week. You can see here the makeup. It was myself. We had 3 school administrators. We had 10 teachers and 4 parents. Everyone unanimously voted for you to consider adopting HMH into reading for our K-5 language comprehension program. It was the highest ranking program in all categories of our rubric, really having a large discrepancy outweighing the other options. Our second choice is Wonders from McGraw-Hill. There is one other option that was on the state-approved list, which is the current program that we have, which obviously would be in third place, which is Benchmark Advanced from Benchmark Universe. Okay, so those are our rankings. 6 through 12, you'll see that their teacher rubrics are 53. However, please know that that is ELA committees or ELA departments in secondary are very different, where K-5 would really be every classroom teacher we have teaches English language arts with a few exceptions. In 6 through 12, they have ELA departments, so 53 is obviously much fewer, however, it makes sense there. They had 8 parent rubrics completed. Again, we can't discern the 157 hits. They did have district staff, school admin, teachers, and parents on their committee, unanimously voting for McGraw-Hill Study Sync as their #1 option, and then Savis's program, My Perspectives, as their #2. What questions do you have that we can answer?
With the HMH or any of these, I know a lot of this, the disadvantages, it's kind of their most up-to-date version, but you know, they have similar programs, right? Is part of this evaluation process looking at maybe schools' success with these programs?
Yes, so I am actually currently in a conversation with a district that's using an older version, as you said, of HMH. The one that we're looking at is their 2026 publication. They are actually similar to us in that they prize their partnership with Wilson's Foundations for our decoding and language comprehension, or decoding and phonological awareness, which we would be looking at continuing that ourselves. And so I've been able to really pick their brains on what has worked and what do we need to have like preemptively planning for. One of the benefits of this unique timeline is that once you all vote, once November comes and goes, should there not be anything in the contest period, we'll be able to start curriculum mapping in November and December, which allows our stakeholders the full second semester, when typically that is something that's shoved into the summer. And then teachers come back in August to learn the new program. But this would actually allow us time, to your point, Ms. Ruddy, to look at these resources, start using some pieces, see what we love, see what we want to kind of replace and duplicate over the next 5 or 6 months before we're in full adoption, which I think is a big perk. A lot of the barriers that the curriculum mapping team brought up can be overcome through the time that we have to explore with some of the materials, and also through curriculum mapping, which is how we'll map out how we use all of the resources.
It's also a cost-saving measure for us because we're not jamming it into the summer right before that. It allows us to build over the course of the rest of the year to accomplish that. I will also point out that this is a 4-year purchase, not a 5-year, which you typically do. It's a cost-saving measure because we had still 1 year left on our adoption. Remember, the state moved up the timeline on ELA. We felt like we were in a good place with our product, and it helped us save some dollars as well, just looking to purchase a 4-year adoption as opposed to a 5-year adoption. And our timeline, just reaching back to that, so at our next meeting on the 28th, the board will make the recommendations to approve, and then from there we begin our 30-day to contest adoption period, and that will conclude November 29th, and at that point we'll be moving forward. Okay. Any other questions?
I appreciate how much detail and the seriousness you put into this, because it is really important and it helps with our values and mission in the long term. Thank you.
Very proud of this team's work. We have been honing our skills in this space for a number of years now, and it shines through just when you see the number of staff members that are engaging in that process. It's better buy-in, and then there's better fidelity with the content, right? And that helps it all the way around.
Is this instructional application quite different, or is this something that our staff can relatively easily transition to? Is there going to be a lot of PD need up front in order to adopt this?
I think when we get into it and start building our map, we'll have better understanding of that, but we will be providing professional learning around the content as we do each year when we make adoptions.
Yeah, and remembering that, this is going to be a resource, but really, the work that we've done to our standards, our teachers are going to also go into that, not learning new standards and a new resource. I think also helps with their rubric completion and all of that, because they know the standards. And so now it's just, I need to learn this new tool where these things are and available. And I think the timeline is going to give them an opportunity to play around with it and learn before it is required for them to just jump all the way in.
And something, I'm so sorry.
No, go ahead.
When I was here with you last time explaining the professional learning we were doing that was outlined in the SERP, I think that will speak to a lot of this work in that we're looking, and we've invested in a lot of professional learning around the science of reading. So I'm looking to lead K-5, I'm sure Ms. Everidge as well for 6-12, into mapping these resources aligned with the reading road and what we know to be the skills that need explicit instruction. And that PL has been well-versed and continues to happen. So I think, like Superintendent Moore said, now it's just plugging in. It's this text instead of that one, but we know exactly what to do with it.
And through Superintendent Moore's vision, we have been bringing this now through the SERP to our school leaders now and providing them the science of reading instruction as well, so they could be stronger instructional leaders on their campuses around this content.
Wonderful job.
All right,
Thank
thank
you
you very
guys.
much. All right, so now in 9.02, Ocean Center Graduation Agreement. We have Dr. O'Brien present.
Hi, good
Welcome.
afternoon. This should be pretty quick. A standard Ocean Center agreement. From last year, we did have a bit of a price increase. Last year, the arena fee was $4,000. It is $5,000 this year. And just to highlight, our graduation will be held on the 31st of May.
No other changes to the conditions?
No other changes to conditions. We've had to navigate just some changes in rehearsal schedules given the week that it fell on, but otherwise no other changes to conditions. And there are times where in the itemized schedule that is a few pages
Right.
down where
Yep.
they might add more security and then it gets adjusted at the time on the day. We actually, I believe, saved a little bit of money last year after we got the pool.
So that
invoice.
staff is not included in the 5,000?
It's, I don't believe so. I'm trying to, let me
Is this just
make
the
sure it's in the
venue?
itemized.
Huh.
Nope, it is in there. Yep.
Staffing, equipment, and
Mhm.
miscellaneous
It's on
expenses.
page 8.
Okay, thank you.
Okay, so with that 5,000, when we arrive there and everything's all set up, the stage and the chairs all lined up, everything, that's all part of that 5,000? They do all that work?
Everything that's in the arena, yes.
Yeah, okay.
Mhm. And then we have other vendor contracts for things like lamps. and-
Yes.
Right.
Yeah,
okay.
all the other.
Decorations are.
Yes,
The
they're not
pizzazz.
included.
The pizzazz, yeah.
Okay, great. All right, thanks for that clarification.
Sound.
And I
Because
know
we
it's
wanna be
on
heard.
a Sunday, and I
Yes.
just, and is there anything just for the community and public, just to, for anyone that had questions on why it's a Sunday, maybe just explaining if there's any
It was really
reason or not reason or availability,
just the closest
probably?
date that we could get. So we work in concert with Volusia County, and
Mhm.
so, you know, they have a lot more graduations to fit in, and so ours, that was the closest date that we could find to the end of school.
And they have a contract around the dates directly with the Ocean Center, longstanding contract. And so the year, it kind of ebbs and flows. You know, a few years ago, it was on a Saturday, and it's
Yeah.
back during the week, and now this
Yeah.
year, it's on a Sunday.
And I think it's just good just for them to hear, because I
Yes.
think, but no, yeah, it was a great ceremony last night.
It's going to be a
Yeah,
great one.
we look forward to it.
Always.
About a weekend.
Yeah.
Thank you.
All right, so we'll move on to 9.03, student progression plan. Welcome back, Mr. Reeves.
And this is to answer any questions that you may have from the last time the team was together.
Yeah, on page 11, it says grade placement, students transferring from out of, well, that's the country. Don't we have one transferring in from other entrance to schools district? Okay.
Page 10.
Yeah, sorry, page 10. How is it, can you help me understand or connect the processes and procedures, standard operating procedures with the policies here about when we have a new student and we're evaluating their grade placement from home, charter, private education, or even a student who may have come from another education public education school, but doesn't have documentation, with the fact that I believe we essentially say, if you come and you register, they get to be in class within like the next day. So is this actually able to happen in practice? Are we actually evaluating these students in order to make that proper placement? Or are we sometimes defaulting, or maybe too often defaulting to a chronological age for placement because of the challenge with the timeline?
No, we take into consideration a number of factors, and there are links on page 10 that if you click on them, they take you to what we have in place to help and assist in that place. In addition to that, usually there's transcripts for like 90% of the situations from another district,
Sure.
either private or public, right? Where the questioner comes in is potentially our home education students, when there's not a transcript, but statute says we have to take at face value. If the parent's telling us that Jeffrey has completed the 7th grade and has this information, then we place them at that grade level and move forward. If Jeffrey is struggling in that space, then there's usually multiple conversations about placement and looking at how to help them be successful. But that does take place.
And in practice, we typically can, it depends, and it really depends on when a student is registering. And so we try to get the turnaround quickly, but if at the time of registration, we have questions about grade or course placement specifically, we began reaching out to the school, and we may delay that student coming within that 24 hours, right? If it's a Thursday, we'll say, hey, we can have the student ready to go for Monday so that we can have time to get that course selection correct. And that really becomes a thing in our high schools specifically, so that we can, make sure that they have what they need for graduation.
I think I'm misinterpreting, because I feel like I'm hearing kind of something different. You're saying, Mr. Reeves, that when a student comes from homeschooling or outside from public education, when there is no record, we take at face value what the parent is submitting. But it says here in kindergarten or 1st grade, it says, if no portfolio is presented, the school will administer a cumulative reading test and a cumulative math test to determine placement, and a passing score is required. So I think that's what I'm asking. So it's saying that if the parent provides a portfolio, that's one thing. So is that what you mean when we say take it at place value?
No, not exactly. We work close with student services through home education. So a parent can literally give us a document that says Jeffrey has completed X, Y, Z, and the state of Florida says we have to take that at that value. And so now if we see Jeffrey struggling, we may add these assessments to see is he placed correctly based on performance. And so if a parent does provide us with that documentation, we have to accept that. But we work.
So there's a separate documentation other than the portfolio that you're referencing?
That is correct.
So should that be in here? Because I'm not seeing that written in the kindergarten to 1st grade placement.
I can look into that for you. It would apply to any grade level. It's not just kindergarten or
Right.
1st grade. It
Well, I
could
guess
be
that
someone
one
coming
specifically,
into-
because it's saying we're going to test them.
Which we can do, and we do, and depending on where the student is at and what the parent's saying. We have some that say, nope, I haven't done anything with Jeffrey the last year. And so we're like, are you sure? Is there anything else? Nope. And so we will then step in and do the assessment to try and figure out determine where's the best placement for.
And beyond
student.
placement, they're given the FAST or some sort of assessment.
But that's well within
for
after the
intervention.
start.
Yeah.
I'm talking about we just brought in a bunch of students. There are definitely students who didn't have
And
data,
it's definitely
right?
something to navigate.
Right, yeah.
Because other states don't require you to pass all of
Sure.
your
Correct.
courses. You get promoted, you just get promoted. We take that in based on what is allowable for where they're coming from.
Honestly, the bigger question isn't really kindergarten first. We see this more in secondary and middle school when parents have their students and not in a traditional setting, and they're coming to us, and they meet the civics requirement, right, which is so there's some other pieces and parts that we have to look at in that space, but that's truly where we see more of that taking place, not so much in the elementary world, but it's the secondary, which then we still apply those other parameters of assessing to see if we're placed correctly, Did the parent provide a letter attesting to their performance that we have to accept, or do they have a portfolio? But most cases, we have transcripts that we work off of. But we do work closely with our schools to get quickly turned around, because it is a lot to make sure we're reading our transcripts correctly.
One additional piece I just want to highlight that was a change from the last time this was before you, and it's not a substantive change, more around formatting. The partial enrollment section on it starts on page 15. We have kind of reorganized that. It previously spoke to home education and then the personalized education program. We have renamed those categories as home education students who receive no state-funded scholarship, and then students receiving a scholarship, because the process is looking a little bit different now for them to enroll in courses or to access services with us. One being you must submit payment now if you have a scholarship. So
Gotcha.
Yep.
Okay.
Okay. Any other questions about the student information plan?
No, thank you.
Nope, okay, so we'll move on.
Excellent.
9.04.
Okay, this is an amendment to our dual enrollment articulation agreement with Daytona State College. This is putting us in line with, oh, my apologies. I have so many things before you today.
I was stressing I was in the wrong spot.
No, you're in the right spot.
Mr. Reeves always knows what's going on.
So our SIP plans are before you today for all of our schools, as well as Imagine. You should have those an opportunity to review those and just entertain any questions or comments that you may have regarding the SIP plans.
And we will bring the schools before you to provide updates, and we will have same formatting of data.
Right.
That was a request from last time, but they will be coming before you to present their metrics as we move forward throughout the year.
With Imagine, they had a pretty good slip last year. How have we been working to help
Certainly.
them bring those numbers back?
So their goal is obviously aligned to the students with disabilities and some benchmark aligned instruction for the lowest quartile. In addition, Mr. Reynolds and I have been working with them. He is our assessment accountability person, working with Imagine to set, per their contract, their goals academically for the next 5 years, which they provided to us, and working with the Bureau of School Improvement, the BSI team from the state of Florida. And we held a meeting last week with them. We invited Imagine to do a learning walk with us at Middle Elementary School, which they found very enlightening. And they too are looking to try and help kids. And at the end of the day, we said they're all our students, whether they're at Imagine or they're here. And so we want to make sure every student has the opportunity to be successful. And a very productive meeting where Imagine has invited the Bureau of School Improvement into their campus to provide some feedback and instructional support in that space.
And just for the benefit of the public, so, you know, the charter school has their own board.
That is correct.
And they are governed themselves, but they still are a public school. And so although we're reaching out to offer help to where we can help, they can take it or not take it. It's really their decision there, correct?
That is correct.
Okay, gotcha. So, well, thanks, because again, that's what it comes down to at the end of the day. These are all of our students, and we want them to get the best education. So if we can support our charter schools also, then that's great. I'm glad we've made that initiative.
Yes, sir.
All right. Any other questions on 9.04? Okay, hearing none, we'll move on to 9.05, Daytona State College and Flagler School's dual enrollment articulation agreement amendment.
Now we're going to talk about the amendment. So this here is to align with House Bill 1105. There was some specific language in this bill that addressed transportation. And so working with Daytona State, we felt like an amendment was the best way to articulate that information. And so basically the amendment's going to read as follows: students and or their parents or the legal guardians are responsible for providing their own transportation, DSC. And Daytona State and Flagler County School Board are not responsible for the cost associated with student transportation. And DSC will inform students and their parents or guardians of that in writing and the options they may have available to them. And this just puts us in line with statute. Any questions?
Doesn't appear to be any, so move on to 9.06, University of Cambridge International Education and Flagler Schools Agreement.
Yes, sir, thank you. So from time to time, we have to renew our agreements with either IB, International Baccalaureate, or with ACE, which is Cambridge University's diploma option. And so we are bringing that before you today, is renewal. Just some highlights from this is that there is no annual fee now because of the number of students that we are testing. It's about $11,000 savings for us.
Nice.
Currently, this year, we have 746 students that are taking some of the 24 offerings at Matanzas High School. It's almost 35% of the student population is in an ACE course in some capacity, whether they're going through the diploma option or not. And so we're excited about that. This does represent approximately a 4% fee increase for the exams, but that we have moving forward that, and that we still have one more year left on the student data privacy agreement. And so, any questions that you might have for this?
When you say we have one more year in
Yeah.
the student data what does that mean?
So-
Is there going to be a renegotiation and a cost of that?
No, that's what we work through with technology. The state requires us to have a data privacy agreement in place. They just had to renew their agreement with us before the expiration of their plan that we have in place with them initially. So
Which is why you don't see both coming.
coming together.
We already have it.
Because we have it, we have it.
Okay.
Yeah.
Right,
Okay,
so
got it.
2 years ago, I aligned all of our articulations with our data privacy agreement, so the hope was that they would sunset and rise on the next,
Yeah.
let's say, together. And I worked with technology, asked me, does this going to prove a problem for you in that space? They said no. And so we let them know that the data privacy has one more year, then we'll update that with them. It's a separate document. This is just how we do business with them as far as fee structures, testing, and that kind of stuff.
Very good.
And I want to remind everyone, those instructors, so 16 of those courses that we offer were well above national average. So I think when they saw the reapplication of us, they saw how wonderful our students are doing, which means our instructors are.
Their pass
They're
rates,
doing
yeah.
The
great.
pass rate.
So,
193 students have earned their ACE diploma, with 108 with merit and 12 with distinction. And these students are literally across our state, at college universities, and across our country. So very proud.
Very good. All right, thank you very much.
Thanks.
We'll move on to 10.01, student-teacher affiliation agreement with the University of West Florida, and we have Mr. Robertson.
And we're going to ask Mr. Ouellette to come on and come with him to tee up for 10.03 with our personnel to begin saving some time in our transition.
All right, good morning, board and the superintendent. We presented this at the board meeting before. Right now, we just want to know if there are any questions or concerns about what you've read in the agreement. It has been reviewed by our attorney, and so he made the necessary adjustments to it, sent it back to UWF, had them fix it.
All
and
the
then
lawyers
sent
are
it back.
finally happy.
Yes.
They're happy.
And because this is an agenda meeting, this is why it's on before
Yes.
you. But if
Gotcha.
you have no questions, we will shift right on to the next item.
Okay, so 10.03.
This is part of the ongoing process as we add things to the personnel docket and as we head towards the next board meeting.
Okay. All right. Thank you, Mr. Ouellette. And Mr. Robertson, thank you. Okay, so that moves us on to 12.01, Florida State. Oh, no, okay, we already did that one. Sorry, we're going to go to 12.02, First Amendment to the Interlocal Agreement for Public School Facility Planning.
Good afternoon, Board. Superintendent Moore. I'm here to bring to the First Amendment to the Interlocal Agreement. Basically, it adjusts the frequency of the student generation rate study from annual to biennial. So that's about $16,000 of cost savings on an off year. And it's the frequency is comparable to other school districts like Volusia, which does theirs 2 to 3 years. They do an informational review Clay does theirs in 4 to 5 years with their impact fee review, and then Lake also 3 to 5 years with their impact fee. There are no, it's just an administrative change. There are no policy changes, so.
What brought this forward, this change?
It's mostly because of the cost and because the student generation rate in 2021 did not change as much in 2024, so it remains stable. So say if you're going to review how many in the difference between the 2021 and 2024 student generation rate for say 1,000 dwelling units, there's just going to be an additional one student between 2021 and 2024. So.
And
Well,
I think to,
I was just, well, I just, was it your recommendation, or was this the?
Yes,
it was your recommendation?
yes.
Okay.
excellent. And I think there might be some confusion for people at home watching, thinking, oh, we have all this development, how could they not want to change the student rate? Well, it is the ratio that we've, essentially, there's a study that used to be every year that we determine what's the ratio of students per size of housing development. We're just saying we're going to evaluate that study every 2 years to get that constant ratio. It doesn't mean that we're not evaluating every housing development that goes in.
Yes, and the student generation rate is a long-term, long-range rate, and it does not we don't consider the short-term fluctuations. And if there are going to be any changes in demographic and or housing trends, then the ILA also provides for a study in between.
If we need
Okay, that was my question. So if there was like a major housing boom, between studies, are we able to request, something before the 2-year mark?
When we collect the permit data, the enrollments, the capacities, and we do that annually, we detect early if there are going to be any changes.
Okay. And I see here that there have been some signatures on here, but it looks like
Yes.
Flagler Beach and Palm Coast have not signed it yet. Are they all, is everybody on board with this?
Yes, everyone has signed. Bunnell in September the 8th, Flagler on the September 15th, Palm Coast and Flagler Beach 7th and 8th respectively. So it's just as the school board, once the school board executes it, it's going to go to record.
Okay, very good. All right. And we'll move on, 12.03, Legends at Palm Coast. This is a proportionate share mitigation agreement.
So, if you have any questions.
Where in Old Kings is this? Is this
I was
north
asking
or
the same
south?
question.
It's north.
Right next to the
P section?
The map is,
The maps are always awful.
I wish they gave us a macro view and then the mic, so
Well,
to
this
figure
one's
out where
not
I'm
as bad.
at.
This is actually a better one, you're right. This
you
is the
can
best.
see the
You can kind of
Yeah.
see where it is.
Yeah.
I guess what I'm
actually,
worried
you're
about
right.
is, and maybe that's what you're wondering, is how would that impact traffic against Old Kings Elementary, but this isn't near that.
No, it's
Okay.
further up,
no,
yeah.
it's farther.
Yeah.
And this is apartments?
Yes, these are apartments, and they're gonna generate about 18 students, 8 in Old Kings, 4 in Indian Trails, and 6 in Matanzas High.
So these are rental apartments? Not condos,
Highly
right?
likely.
Yeah, not likely.
For the 8 elementary for Old Kings, and I know it's 8, but for, increase in size, is that there's no room for portables potentially, right, still there? 'Cause
And not necessarily at the time with that generation,
Okay.
because there's not, at this time, we're not considering adding portables
Yeah.
to Old Kings Elementary School.
So, yes, when they come to us, we give them 3 to 5 years
Mhm.
before we can see a student generated from that site.
Okay. Very good, thank you very much.
Thank you.
All right, so 14.01, this is request the board's permission to advertise for banking and P-cards.
Good afternoon once again. I would like to introduce Peter Drolet. He is our new coordinator of purchasing. Peter is a recent graduate from Florida State University, and he comes to us with some heavy experience in an internship that he did. He has jumped right in, already started making great state networking contacts, and we are looking for him to rebuild up purchasing from the ground up.
Awesome, thank you, welcome.
What Peter's first big job that he's working on is the RFP for banking and P-card services. This expires March 31st, 2026. We are currently with Ramirez for banking and JP Morgan for P-cards. So we will have to take this out to bid again, and we are asking the board's permission to advertise this RFP.
So these are like, almost like, just for quick purchases on small supplies, so that it also, you don't have to expend your own money and do a reimbursement type of thing.
For the
Right?
P-card, yes.
Okay. I'm not familiar with the
But
term
the-
P-card, so I didn't.
But for the banking,
For the-
it's not.
The banking services is for all of our district bank accounts, which
Okay.
there are probably about 14. This does not impact the school's internal bank accounts, only the districts.
And why entertain the change?
Because
What
the
are we looking-
contract is up.
And it's
We have to go out for bid. The 5 years ago, the contract was for 3 years with 2 one-year extensions. So we are at the end of those 5 years.
And you're seeing a better set of services by switching?
No,
We're not
we have
switching.
We have to go out.
Oh,
for bid.
time for
Yes,
the
yes.
contract.
Yeah, we have to go out for bid, and we'll see who bids on it, and then we'll have a committee.
Okay, my apologies. I
Yes,
saw
yes.
the two banks and assumed it was a switch, but you're saying there's one for P-card and one for.
Correct.
Okay.
Yeah, when we bid on it 5 years ago, Ameris only bid on the banking, and JP Morgan only bid on the P-cards, I do believe. So it ended up being 2 different ones, which is fine. It has worked out well. They don't really cross.
Okay.
Okay. Very good, thank you very much.
Thank you.
All right, so that moves us on now to public comment. Do we have
I
anybody?
was like-
We've covered a lot of ground in a short amount of time. We got
I
caught
was
back
scared
up.
when I saw this.
No.
Anybody for public comment?
There are no public comments.
Okay, great. So we will close public comment, and that moves us on to board member requests. Ms. Ruddy, you had a board member request you said you wanted?
Yeah, I think this is making a bigger deal of it than it needs to be. I just wanted to maybe spend a couple of minutes discussing our norms at workshop meetings versus school board meetings. I think just to add that for our benefit, we can't talk outside of this, so it would be helpful. We'll have to circle back, and there was something else, but I don't recall. I may have to wait.
Do you have any board member requests? No? Okay. So we'll move on to closing comments, and start with you, Ms. Ramirez.
All right, so I wanted to thank everyone coming. We've been seeing a lot more participation in our meetings, so thank you with everyone sharing their thoughts and through also social media. And I wanted to talk a little bit about family community engagement, but before I want to take a brief moment to highlight something really important about our school safety. So this week I was able to attend the active threat training alongside our school resource deputies and their whole team, so it was very eye-opening. We even acted out a live scenario, so my heart, it was like racing like crazy, but the hardest part was realizing how disoriented you really are in the moment. So even knowing like layouts of schools, but this experience, it gave me a really deep appreciation of how well trained, calm, and prepared all of our SRDs and all the staff that were there are. So when it comes to any type of threat or life safety situation, so we are very incredibly fortunate to have such dedicated men and women protecting our students and staff every day. So thank you so much for that experience. So I wanted to make sure everyone knew how well trained they are. And then I wanted to shift back to family, community, and engagement. So during one of my last closing comments, so I spoke about the importance of family, mentorship, and community involvement in all of our schools. And so what I wanted to say and what I meant to say is that I was encouraging more parents, guardians, mentors, and volunteers to get involved. So always in partnership with our schools and with parental consent. And as a mom of 4 little ones, well, big now, little and big, in Flagler schools, so I really deeply value and I respect parental rights and involvement, and that's why I want to continue and I'll always support our state-approved and vetted volunteer programs. For example, All Pro Dads, Take Stock in Children, Reading Pals, so many more. All of those programs, they help our families and community members. They help us stay connected and support all of our students in positive ways. So I wanted to share that, and I hope everyone has a fantastic week, and thank you very much for the safety training opportunity.
Yeah, to build on that, I think one of the items that Ms. Ramirez brought forth with her connection from the Kiwanis Club, talk about community support. There was a fundraiser. Ms. Ramirez, myself, Ms. Judy White, a teacher at Rimfire, my husband Tim Ruddy, we all did our best and tried to get up there and bowl. It's been a couple of years, but we had fun. At the end, even the county commission group, they weren't necessarily running over with their scores either. So I think I'm going to call it a tie maybe. But the overall event was to support children of Flagler County. It was a fundraiser, and you know, we have some really great partnerships. And it's just, that's another way, if you're not comfortable being a volunteer in a school and going through that process, there are certainly many other outlets to participate in. I'm also looking forward to having a conversation with Ms. Moore, Dr. Halliday, as well as a separate consultation with Dr. King regarding how we can serve our students and paras and support staff with some of our challenging student behavior needs and how we can better prepare and arm them with that, with the proper responses. So that is coming up, and I'm looking forward to it. And everybody's been very open and collaborative in having those discussions. Finally, I just wanted to remember Mr. Kelly Fox, who was a member of our teaching staff. I taught alongside with him many years at Rimfire, and then he had most recently worked at Bunnell, and he has since passed away. And his children, Gabe and Anya Fox, are incredible human beings. They were good friends of my children, and Mr. Fox was just super witty, very just fun to be around. The students loved to be in his class, and he has forever left his mark on our Flagler family and our students, and my heart is with his wife Emily at this time. Thank you.
I'll just extend condolences for Mr. Salinas and his wife. It's a huge loss to our community. You know, I saw so many comments out there just on his kindness, and I think that's something we all felt whenever he would say hello or come to one of our meetings. So just praying for that, for their family, and that loss in our community. I'll just give a shout out to Bunnell Elementary. They have a school store. Be nice to see, you know, I'm hoping all of our elementary schools will incorporate that eventually, but if you'd like to donate, they are accepting things. Five Below is a great place to just get some little things, and the kids really love it, and it just motivates them. So just putting that out there. And have a great week.
Yeah, I just also wanted to issue condolences for both these dedicated people that lost their life. They'll be missed, and just love to their families and prayers. And I wanted to go to the celebration of life yesterday, but I was out of town. So, but I just wanted to just let the Salinas family know that we're praying for them, and wish them coping with their loss. So.
Yes, happy 45th day of school. So many great things happening as we round out the first 9 weeks of school. Cannot believe it that, you know, already 9 weeks down. And so many great things happening. I'll tell you, Miss Ruddy, Dr. O'Brien and I had the opportunity to represent Flagler schools at a bowling event at FADS, and we too did not represent the district very well. So we need to spend some time at both our Matanzas and our Flagler Palm Coast High School bowling students, join them at their matches and get some pointers because, you know, we definitely needed a few pointers, and I'm gonna just say maybe it's just been a long time. That's what we're gonna say that it was. I want to give a shout out to our transportation team. Just from today, they were extremely short, and so several people just needed to fill in and provide some support, but truly that team, that staff, they really wrap around each other and provide for the loss and the shortcomings that come. And so just shout out to them. Thank you for the patience of our families, you know, as we were sending out information. And I will tell you, we sent out information all the ways that we could send it out. So if you did not know the bus may be late today, then I would say you should definitely have a conversation with the individuals at your child's school to make sure that you have your email address is accurate, your phone number is accurate, all of the things are accurate, because as we were walking up, one person at a school said, I got it 5 different ways, right? And we wanted to make sure that families knew what was happening. Report cards are available on Skyward, and if they are not available right now where you can see it, you will be able to see them by this Friday when report cards become finalized. And so families, please, please, please make sure you have the proper access to Skyward and you can go on and see the student progress. And then I will end with condolences also to Kelly Fox, an amazing educator here in Flagler County, great family as well. And so we ask that you have thoughts and prayers towards towards his family, and then again to Jorge and to the entire county, Flagler County workforce there. That is huge for them, and so anything that we can do to support them, we will continue to do that. So thank you, and we hope you guys have a good night.
Okay, this meeting is adjourned.